Hello everybody. I am Dr. Subhasis Ganguli, a senior consultant physician in the field of internal medicine, practicing in some of the multi-specialty hospital in Calcutta. So today we are here to discuss about understanding hypertension. So what is hypertension, or what is a normal blood pressure or high blood pressure means? Everyone wants to have a normal, healthy life, and blood pressure is an essential part of that life. Each time when the heart beats, it pumps blood into the blood vessels, and it creates a pressure against the wall of the blood vessel, and this is called as blood pressure. Normally, in healthy person, it rises and falls throughout the day, but when blood pressure remains high for a longer period of time or it's left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal value is known as hypertension. Now, this hypertension usually develops over time, and it can happen because of so many reasons, out of which the unhealthy lifestyle, for example, not having regular physical activity, having obesity, a smoker, these are the unhealthy lifestyle which can cause hypertension. There are other risk factors as well which can also increase the risk of developing hypertension, such as age. As people get older, the arteries get stiffen up and narrow, and excess fat builds up in the arterial wall. Now, family history of high blood pressure, like one or more family members in one family, if they have got hypertension, it increases the person's risk of developing hypertension. Excess salt intake is one more important cause of hypertension. Not eating enough food with potassium, they can also increase blood pressure, and the risk of stroke or chronic kidney disease increases. Eating processed and fatty foods, that also increases fats throughout the body and make the heart work harder to push blood through the body, so hence causing blood pressure to rise. So lack of physical activity is also linked to the obesity and further rise of blood pressure. Another important factor is stress, and reacting to stress in unhealthy ways or unable to manage stress is also an important cause of increased blood pressure. Now, moving on, hypertension does not have any obvious sign and symptoms, but definitely it will present in such symptoms like vertigo or a persistent occipital headache, and it can also sometimes give rise to easy fatigability, breathlessness on exertion, and tingling sensation all over the body. So if hypertension is associated with some other disease like cardiovascular disease or diabetes, their presenting symptoms can also mimic and can give a impression that the patient has got hypertension. Now, also sometimes hypertension present without any manifestation, without any symptoms, so it is called as a silent killer. Hence, early and accurate diagnosis is very important in management of hypertension. But how do you know that the patient has got hypertension? So you have to measure the blood pressure. Now, when symptoms occur like tiredness or headache, then there can be a buzzing of ears, tinnitus. Sometimes it can be associated with nausea or vomiting, and these symptoms usually warns a patient that he should get his blood pressure checked. And fortunately, blood pressure can be easily diagnosed if one is very alert and conscious. Now, this instrument with which the blood pressure is measured is called sphygmomanometer, and it's recording two values or two numbers. One is systolic, the upper value, and the lower value is called diastolic. Now, a normal blood pressure is like 120 by 80 millimeter of mercury, and it can also read as 120 over 80 millimeter. Now, the upper number indicates the systolic blood pressure, which means that the pressure in the blood vessels when the heart contracts, and the lower number indicates the diastolic blood pressure, that is the pressure in the blood vessels when the heart relaxes and the heart rests between two heartbeats. Now, if the blood pressure is more than 140/90, we say that the patient has got hypertension, and if pressure has got much higher than 140/90, then the patient is at risk of developing heart disease or other risky disease like cerebral stroke, etc. Now, this can be prevented and reduced by taking a few steps towards a healthier lifestyle, like patient, or they can have a regular exercise, they should have a healthy diet, they should quit smoking, regular blood pressure monitoring, stress management, and strictly adherence to medicines. They should take their hypertensive pill exactly as their doctor has advised for that. Now, if blood pressure is successfully controlled with such lifestyle modification and medications, then they should have a healthy life. Now, I'm coming one by one, like regular exercise or physical activity. What does it mean? It means that exercise can lower high blood pressure. Regular activity can make one heart stronger, and if one have a strong and a healthy heart, it can pump more blood with less effort, less resistance. So if heart has to work less to pump and force the blood vessels without any resistance, it will decrease the blood pressure. In other case, we all are aware that age and weight gain, these are the two major risk factors for high blood pressure. So if we can keep the blood pressure at a desirable level, that is around 120/80, then exercise can help prevent it from rising. And also blood pressure, as it can happen in different age group from young to old, so everyone has to understand that the blood pressure value should be kept considering their age. Like in the old age or in the middle age group, the blood pressure, higher blood pressure can goes up to 130, 140, but in young age it should be around 110 and 120 systolic blood pressure. So one can aim for a 30-minute aerobic exercise, and it can be controlled by brisk walking, jogging or swimming. Now, what do you mean by a healthy diet? It has got an important role in managing blood pressure, and that diet should contain high amount of vegetables, fruits, whole grains. These are required. And for lowering blood pressure or preventing hypertension through dietary intervention, can adopt a dietary pattern like DASH diet or a Mediterranean diet, eating less saturated fat or total fat, getting plenty of potassium, and limiting the amount of sodium in the diet. Now, DASH stands for a dietary approach to stop hypertension. This is food should be rich in whole grains, fruits, vegetables, low fatty diet, and dairy products should be low, and schemes on saturated fat and cholesterol can lower one blood pressure by up to 11 millimeter of mercury. That is, if the patient has got high blood pressure, like suppose more than 140 or 50, then that can be reduced by only through a good dietary approach. Now, small reduction in the sodium in the diet can improve the heart in a healthy manner, and it reduces blood pressure by about 5 to 6 millimeter of mercury. Now, decrease sodium in your diet, or you can consider tips like read the label of food cans, or sometimes there are foods, they give all the details of their calorie, their salt intake. So try to read that and reduce your salt intake. And processed foods, you try to avoid processed food, and because this processed food, usually there are so many salts, sodium and some ingredients are added which can alter the fat level of the blood vessels, so that should be avoided. And don't add additional salt in your diet. There are so many people who have got a habit of having additional salt, that should be avoided. Now, smoking is also an important factor because it increases the thickness of the blood vessels. Also, they create lipid disorder, and due to stress and smoking, that the resistance of the blood vessels get increased. So one should stop stop smoking, and that can help also to reduce your blood pressure and avoid heart diseases. Now, regular blood pressure monitoring is very important to know about one's hypertensive status. Now, either you can come to your visiting doctor and check your blood pressure, or you can have some nurse or sister, or you can have a digital blood pressure also, but that should be standardized at your home so that you don't have a faulty measurement or faulty value. Self-monitoring blood pressure at different times, it should be seen during the daytime or evening, afternoon, in the night, because there are diurnal variation of blood pressure which is normal, and one should not get worked up with a little bit of variation in the blood pressure. So apart from this, we should know how to manage our stress. Stress management is extremely important because our emotional, physical health, usually if we can manage stress, they can lower the blood pressure. And apart from exercise, we can do certain co-curricular activities like reading books, listening to music, and focusing, and we can plan or we can practice meditation, or we can spend some quality good time with our good friends. And there are so many ways you can manage stress, and I think that will definitely help in reducing the blood pressure. And last and most important is one has to adhere to his medications, because unless and until you know your medicine for your blood pressure, you should know their effect, their side effects, and the timings of taking the blood pressure medications. It is the most important issue. It can so happen that you can have a little bit of drug side effects, but that has to be discussed with your consultant, with your physician, just to get rid of the fear what you have with that medicine. And one, if it is very sincere with the medication, sometimes it may so happen that you can reduce the number of medicine in near future. And if you can control your blood pressure and go on with all the healthy measurements, then there are you have seen instances when a patient does not need their medicine for blood pressure in the future. So I think in short, everyone should be aware that what is blood pressure, what is hypertension, how to prevent it, and how to deal with it. And with this, you can have a normal life without having any form of fear or anxiety. Thank you very much.